Assalamualaikum and good morning, Dr. Ayah and my fellow friend. Today I will present about principle of hemostasis. Index: History of hemostasis and introduction to hemostasis. Basic principle of hemostasis. Etiology of hemostasis. Case study: clinical hemostasis, cardiac surgery for a Down syndrome patient. Clinical history, scene and symptom, laboratory finding, treatment and conclusion. The component of blood hemostasis: platelet, blood vessel, fibrinogen, coagulant, anticoagulant, fibrin, embolism, thrombolism, hemogen, endothelium. History: hemostasis. Hemostasis is derived from the primitive man realization that check bleeding mean that up to Lister experiment developing the prevent the observable literature. The early Greek and Roman used the vegetable and mineral tip on the wood received in battle. It was that Micon ministered to Menelaus before the War of Troy. Then the early surgeon began to make intentional incision, but avoiding the blood vessel. There we are uncovered. Introduction to hemostasis. What is hemostasis? Hemo meaning blood and stasis meaning stopping. During hemostasis, blood change from the fluid liquid to a gelatinous state, where the blood will flow slow down easily and starting clotting to prevent blood loss during the injury. Is the process of how the body stop bleeding from a cut or injury involving forming a clot to close the hole in the blood vessel and repairing the blood vessel. When a blood vessel is injured, platelets stick together to form a plug to prevent blood loss. Vascular spasm, platelet plug formation, coagulation. Vascularization is the reflex in which blood vessels narrow to increase blood pressure.
My name is Muhammad Alfiadi. By myself, I am from Group Jabat Al-Ahyan. My metric number is MS17. I am going to talk about basic principle of hemostasis. Mechanism of hemostasis. The narrowing of blood vessels by small muscle that causes slow blood flow and block caused by free factor disease, drugs and physiological condition. Platelet adhesion and aggregation. Adhesion platelets are activated by a number of agonists such as adenosine diphosphate and collagen present at the sites of vascular injury. Plasmatic coagulation to form fibrin clot. When tissue damage results in bleeding, fibrinogen is converted at the wound into fibrin by the action of thrombin, a clotting enzyme. Fibrin molecules then combine to form long fibrin threads that entangle platelets. Within a spongy mass gradually hardens and contract to form the blood clot. Formation of fibrin plug. The final steps in the coagulation cascade involve the conversion of fibrinogen to fibrin monomers, which polymerize and forms fibrin polymer mesh and results in a cross-linked fibrin clot. In the injury, a blood vessel is severed. Blood and blood components, example erythrocytes, are breaking out of the breast. Vascular spasms. The smooth muscles in the vessel wall contracts near the injury point, reducing blood loss. Number 3. Platelet plug formation. Platelets are activated by chemicals released from the injury site and by contact with underlying collagen. The platelets become spike and stick to each other and the wound site. Number 4, coagulation. In coagulation, fibrinogen is converted to fibrin, C part B, which forms a mesh that traps more platelets and erythrocytes, producing a clot. Blood coagulant. In hypercoagulation, is a condition that causes your blood to clot more easily than normal. The hemostatic cascade control hemorrhage and the protective mechanism at the times the process will trigger inadvertently with the blood is within the lumen of the blood vessel without any bleeding. This situation leads to a pathologic phenomenon of thrombosis, which can have catastrophic complication by obstructing blood flow, leading to ischemia and even infarction of the tissue supplied by the occluded blood vessels. In this way, a physiologic process becomes a pathologic process, leading to morbidity or mortality. Some of the examples include antiphospholipid antibody syndrome, factor V Leiden mutation, protein C deficiency, protein S deficiency, prothrombin gene mutation. In hypocoagulation is the condition that occurs when the blood does not clot normally, when there is any defect in the functioning of any component of this hemostatic cascade. It can lead to ineffective hemostasis and inability to control hemorrhage. This can lead to severe blood loss, hemorrhage, and also complications that can ensue due to the inhibited blood supply to vital organs. Some of the examples include von Willebrand disease, hemophilia, disseminated intravascular coagulation deficiency of the clot factors, platelet disorders, collagen vascular disorders. In electrogenic coagulopathy, use of antiplatelet agents like aspirin, clopidogrel, and anticoagulants like warfarin, heparin, low molecular weight like heparin, rivaroxaban, apisaban, dapigatran, fondaparinux, among others for various commonly encountered clinical conditions like cardiac stenting, intervention, atrial fibrillation, deep venous thrombosis, pulmonary embolism, and many more. The way these medications affect the functioning of the various components of clotting cascade can help patients with their clinical condition. However, it can lead to bleeding and result in significant morbidity and mortality. Cardiovascular. There has been increased incidence of bleeding while on antiplatelet agents and anticoagulant agents for recent myocardial infarction, stroke, cardiac stent, peripheral vascular stenting, pulmonary embolism, and many others. This has led to the development and use of reversal agents. Renal pathological conditions like end-stage renal disease can lead to uremic platelet dysfunction, which can be corrected with dialysis and renal replacement therapy. Problem with cascade coagulation. An embolism happen when thrombosis break off without being dissolved and travel through bloodstream to another site will lead to several bacterial infections, septic shock, inflammation, induced tissue damage, and the negatively charged molecules of bacteria activates blood pathways of the coagulation cascade and cause disseminated intravascular coagulation, IDC, in which many clots form and break off, leading to massive organ failure. Will distract artery function to supply blood to a tissue organ. Will cause ischemia and infarction to those tissue. Will lead to pulmonary embolism, stroke, or heart attack. Will damage endothelial damage caused by immune system inflammation, hypersensitivity. Problem with cascade coagulation. An embolism happen when thrombosis break off without being dissolved and travel through bloodstream to another site will lead to several bacterial infections, septic shock, inflammation, induced tissue damage, and the negatively charged molecules of bacteria activates blood pathways of the coagulation cascade and cause disseminated intravascular coagulation, IDC, in which many clots form and break off, leading to massive organ failure. Will distract artery function to supply blood to a tissue organ. Will cause ischemia and infarction to those tissue. Will lead to pulmonary embolism, stroke, or heart attack. Will damage endothelial damage caused by immune system inflammation, hypersensitivity. Table 1 clotting factors. Fibrinogen is a type of plasma protein that has been sourced to liver. Its pathway is common converted into fibrin. In prothrombin is a plasma protein that has been sourced to liver. Its pathway is common converted into thrombin. Tissue thromboplastin is a lipoprotein mixture that has been sourced to damaged cells and platelets. Its pathway is extrinsic. Calcium ions is inorganic ions in plasma that have been sourced to diet, platelets, bone matrix. Its pathway is entire process. Proacceleratin is a plasma protein that has been sourced to liver, platelets. Its pathway is extrinsic and intrinsic. Proconvertin is a plasma protein that has been sourced to liver. Its pathway is extrinsic. Anti-hemolytic factor A is a plasma protein factor that has been sourced to platelets and endothelial cells. Its pathway is intrinsic. Deficiency results in hemophilia A. For anti-hemolytic factor B is a plasma protein that has been sourced to liver. Its pathway is intrinsic. Deficiency results in hemophilia B. For stroke power factor, it is a protein that has been sourced to liver. Its pathway is extrinsic and intrinsic. For anti-hemolytic factor C is a plasma protein that has been sourced to liver. Its pathway is intrinsic. Deficiency results in hemophilia C. In Hepman factor is a plasma protein that has been sourced to liver. Its pathway is intrinsic. Initiates clotting in vitro, also inactivates plasmin. Etiology of hemostasis. The physiology of coagulation undergoes alteration due to various factors including genetics, example hemochromatosis, hemolytic anemia, hemophilia, hereditary spherocytosis, Hodgkin lymphoma, inherited bone marrow failure syndrome, iron deficiency anemia, thalassemia. In medication, example cephalosporin, a class of antibiotics, Daspon, levodopa, levofloxacin, methyl-dopa, nitrofurantoin, non-steroidal anti-inflammatory drugs and SAID, penicillin and its derivatives, cardiovascular medication, antidepressant medication. Procoagulant, relating to or denoting substance that promote the conversion in the blood of the inactive protein prothrombin to the clotting enzyme thrombin. Anticoagulation defects on the coagulation cascade. Heparin is a injectable anticoagulant that activates antithrombin 3, which inhibits thrombin and factor XA, factor necessary in the final stage of blood clotting cascade. There are two types of heparins: high molecular weight heparins and low molecular weight heparins. Quantitative defects of the integral components of the coagulation. Qualitative defects of the integral components of coagulation. And thank you. I will pass this next presentation to Akak Nora.
Assalamualaikum and good morning to Dr. Ayah and fellow classmates. I'm Nora Ana Uthman from Jabal Al-Hayyan with metric number 67. Will present regarding case study, clinical hemostasis case. The case will focus on cardiac surgery for Down syndrome patient. We have 28 years old man who is suffering from Down syndrome, trisomy 21 and congenital heart disease. Undergo pre-op screen before having a cardiac surgery. The pre-thrombin time was found to be low in 2 laboratory previously. Then we sent to biomiss for confirmation testing. The thrombin ratio result 42%. Confirm reference value between 80% to 130%. Before a patient have to go for cardiac surgery, patient have to the few things we have to measure here. Before patient have to go for the cardiac surgery, patient required to do few tests, blood work, EKG, urinalysis. For this, patient do not require to fasting for blood work test, chest X-ray, anesthesia evolution, study patient then we also need to restudy patient history for other abnormal condition. Before we go detail on patient issue, here little info on blood disorder for Down syndrome patient. Polycythemia or erythrosis, an elevated number of red blood cells. The extra blood cell cause the blood to be thicker and leads to blood clotting. Result increase level of hematocrit up to 50% to 83%. Microcytosis or megalocytosis, where is cause enlargement of red blood cell, can lead to leukemia, increased number of reticulocyte, in a way young blood cell, and some disease of liver and the bone marrow, the tissue found in hollow interior of bone where all the blood cells are made. Thrombocytosis, an elevated number of platelets, can lead to certain conditions like stroke, heart attack, and clot in the blood vessel. Leukopenia, low number of white cells, may increase the risk of infection among patients. TMD, transient myeloproliferative disorder, where condition result from repeat growth of abnormal white cell, potentially cancerous. Leukemoid reaction, very elevated number of white cell which mimic a leukemia. Infection can increase the WBC, white blood cells. Okay, next is thrombocytopenia. Decreased number of platelets. If platelets count that too low, may predispose an individual to bleeding. Okay, last info. How does bone marrow maintain the hemostasis? When mineral level in the blood are too high, bone absorb some of the mineral and store them as a mineral salts, which is why bones are so hard. When blood level of mineral are too low, bone release some of the mineral back into the blood, thus restoring hemostasis. Clinical history. Name, Mr. X, age 28 years old, blood group undefined, condition Down syndrome, trisomy 21, gender male, procedure cardiac surgery, probing ratio result 42%, result based on the Ingram abacus, where we can see on the right hand side of the slide. Okay, the test that patient required to do for blood, PTT, partial thromboplastin times, APTT, activated partial thromboplastin time. For the result, one must remember that the volume of anticoagulants citrate in the tube for sample for hemostasis testing is adapted to specific hemoteric test value, which lies between 0.5 and 0.50. This anticoagulants sample blood ratio is valid if HT value between 0.30 and less than 0.55. However, the ratio is no longer valid if we exceed this value. Our patient have very high HT level. This corresponded to poorly filled tube. The coagulant time was falsely increased, contrarily in subject with low HT. Similar situation is found in hyposaturate tube. The time is decreased. According to recommendation of specific society, result must be released under reserve if the hemoteric result is above 55% or lower 30%. GEHD study group on hemostasis and thrombosis, and adjustment is required if the HT up to 0.65. Clinical and laboratory standard institute to adjust the citrate volume according to hemotoric. In this diagram, we can see choline, phospholipid calcium, and also thromboplastin, tissue factor plus PL calcium, intrinsic pathway, APPT prolonged, intrinsic pathway, PTT prolonged, between 25 to 35 seconds and 9.9 to 13 seconds. And then next go to common pathway before they go for blood clotting. This table show about throbbing time test where they will take 14 to 15 seconds. On this test, you will see plate count is between 150,000 to 450,000 L. Bleeding time 3 to 7 minutes. Probing time 11 to 15 seconds. Activated partial thromboplastin time 25 to 35 seconds. Throbbing time 14 to 15 time. Fibromyalgia assay 200 to 400 mv DL. Protein regulation product and dimer 0.11 and less than 500 ml. In this slide, we can see that a few tests for blood disorder. Bleeding time, light transmission, platelet aggregation, independent platelet aggregation, global thrombosis test, and then thrombelastography, and few other more. This table shows a little cost of abnormal coagulation test. APTT, partial thromboplastin time, will test about factor deficiency except for number 7, antibodies to clotting factor, heparin, excessive warfarin, probing time, antibody, warfarin with vitamin K deficiency from mild to severe, excessive heparin, and also for fibrinogen deficiency, TT, or throbbing time, low or absent fibrinogen, dysfibrinogen anemia, hypofibrinogen anemia, heparin. BT, bleeding time, thrombocytopenia, von Willebrand disease, drug, aspirin that cause extra bleeding, cirrhosis, uremia, and PLTS. Finally, from this slide, you can see how to adjust hemocric level in several possibility. Here are few formula that you can be used: McGann formula, Ingram formula, simplified method. Or we can use a graph in order to calculate the volume, and from there we will see how to adjust the level according to the needs. Thank you. Now I'm going to pass this presentation to Daniel. Thank you.
And symptom: decreased red blood cells and hemoglobin can cause symptoms of anemia such as fatigue, weakness, and shortness of breath. Decreased white blood cells or immune system proteins can cause recurrent fever and infections. Decreased platelet or blood clotting factors can cause abnormal bleeding and bruising. Symptoms may relate to increase in blood components. Increased red blood cells can cause thickening of the blood. Entropy cause headache and a red complexion. Increased immune system protein also can cause thickening of the blood. Increased platelet or blood clotting factors can cause inappropriate excessive blood clotting, and blood thickener increase quantities of immune-related proteins, red blood cells, or platelets, and hyperviscosity syndrome, where blood may have difficulty passing through small blood vessels, decreasing blood flow to certain areas of the body. And symptom: decreased red blood cells and hemoglobin can cause symptoms of anemia such as fatigue, weakness, and shortness of breath. Decreased white blood cells or immune system proteins can cause recurrent fever and infections. Decreased platelet or blood clotting factors can cause abnormal bleeding and bruising. Symptoms may relate to increase in blood components. Increased red blood cells can cause thickening of the blood. Entropy cause headache and a red complexion. Increased immune system protein also can cause thickening of the blood. Increased platelet or blood clotting factors can cause inappropriate excessive blood clotting, and blood thickener increase quantities of immune-related proteins, red blood cells, or platelets, and hyperviscosity syndrome, where blood may have difficulty passing through small blood vessels, decreasing blood flow to certain areas of the body. For treatment, here we got 3, which is physical agents. It's a gelatin sponge that have been indicated as great hemostatic devices. Once applied to a bleeding area, a gelatin sponge quickly stops or reduces the amount of bleeding present. These physical agents are mostly used in surgical settings as well as after surgery treatments. Then, anti-hemorrhagic agent, it is a substance that promotes hemostasis and anticoagulant drugs. Conclusion: hemostasis can be treated with efficient tests before surgery or treatment as long as the cause can be recognized earlier. We have versatile tests. Blood disorder can be detected as early as 1 day age.